your mental health is so important. It's very difficult for you to get up and take care of your children or go to work or do those things if you're suffering internally. It really is an inside out sort of thing.
Hi, everybody, and welcome to the Finding Mental Wellness podcast. My name is Gethin Lieberman, and I'm a founding member of Midwest Recovery Centers. Coming up, we're going to be discussing how substance use disorder treatment has many areas it encompasses: therapy, family work, self-help, and of course, medical. But just how does effective treatment integrate the medical component with everything else that it's doing? Well, I can't think of anybody better to speak on that than Shay McNeal, who is a nurse practitioner and the medical director of Midwest Recovery Centers. We're going to be talking today about how the medical side of treatment can merge with therapy and everything else that an effective treatment center does to really teach people the coping skills and the strategies they need to have an effective treatment experience, along with really examining the stigma behind not only addiction, but behind the medical treatment of addiction as well. All right, Shay. So you wear many hats in your world: medical director here at Midwest Recovery Centers, advocate, mother of six. What inspired you to pursue a leadership role in addiction and mental health recovery?
That is a really great question, and I get asked a lot, how do you balance it all? And I think the short answer is I don't know. It's just one of those things that you just do. I've come to a place in my life and in my career where I've been lucky enough and honored enough to really be able to pursue multiple passions. Again, having 6 kiddos is wild and crazy and, kind of a zoo at all times, but it's something that obviously I really love. I've been a mom for quite literally the majority of my life, because I was a young teen mom. And so I did become a mom before I became much of anything else, to be quite frank. And to have like just the privilege to bring so many lives into the world and to be able to, watch my babies grow and then later in life have more children has really been truly like just an act of passion and love and happiness. And to pursue my professional career as a nurse practitioner and to be able to get this position at Midwest Recovery Centers as medical director, I think was just very serendipitous. Funny story, I tell employees who are new, I tell friends, I tell family that I do feel like MRC kind of fell in my lap in a very strange way. I wasn't necessarily looking to be, a medical director or to create a medical program or to watch it bloom and and just blossom in the way that it has. It came at the right time in my life. I had made the decision that I did not want to just work as a cog in the machine anymore. I wanted to really contribute to my own passions and to my own pursuits. So again, all of these things have really just lined up, whether it is as the medical director, or as a mom, or as a wife, or someone who travels a lot. And again, being an advocate for nurse practitioners, being an advocate in the world of addiction and recovery and in mental health has really just lined up in this really beautiful way that although it is a lot of work and there is a lot of craziness, it feels very good and authentic and in a way easy. Not saying I'm a day-to-day easy, but when I, lay down at the end of the day and I think about my life, it just works and blends in this beautiful sort of tapestry sort of way that I could not have planned out better. So although it is a lot, and I do agree with people that it is a heavy load, it's one that I do not mind carrying and I love because it really feels true to where I wanna be and what I wanna be doing, so it doesn't feel like work at all.
And you're clearly really passionate about that and everything that you do. So, that really reigns through. So let me ask you this, as somebody who's in the medical profession, right, and who has had some, not personal as in yourself experience, but have had some family members struggle with addiction. Now, how do you think that personal history has shaped the way you lead here at Midwest Recovery Centers?
I think it definitely has a huge impact on my understanding, on my sympathy, on my empathy, on also not just having that love, that passion, that understanding for our patients, but for the family members themselves, because I have been the daughter of a parent with addiction. I have been the girlfriend of um a person who was going through addiction and recovery. And I think that it really has created a very unique lens for me to see the work through. It's allowed me to see areas that I wish in the past that my loved ones had. I wish that they had someone who set really firm boundaries at times. I wish that they had someone who just gave them that one more chance sometimes. And so trying to not only provide what I think would have been really good for my family, but what would have been really good for me at the time as well as being a family member. And so I do think that having that experience and not just from family, but friends, multiple friends who have, went through addiction and whether they did so quietly and it wasn't outward or whether we were able to see that in the outward sort of fashion, whether it was confided in me or not. All of those many, many experience have really given me a more well-rounded view of what it means to work in this field. So it's not just a job. It's not just, something to make money or I get up and do. It really is a mission, so to speak. I laugh when we're doing orientations with new employees. And I do say, like, you don't come to Midwest Recovery Centers, you don't work in the world of substance use disorder or mental health to get rich, right? You work in this field because you do have a unique passion and a unique love for it. And I think having those experiences have really just given me not just the education that I learned in school, but the heart that I need to lead an organization like this. And I think that that's what is kind of the secret sauce at MRC is that so many of us have an experience within the world of addiction, whether it's through recovery with yourselves or a family member or a neighbor down the street. So I do think that it's created more of a well-rounded view of our patients, and helped me to piece together the things that I would have needed, the things my family would have needed, and maybe some of that, just science and evidence-based practice to create what we have today.
Yeah, that makes a lot of sense. I always thought it's kind of a unique field in the sense that not a lot of people have it on their list of things they want to do when they're like in high school, right? Like I have some teenagers, you have some teenagers. I got one that wants to be a teacher, another one that wants to play in the NFL. So telling him to take some like sports marketing classes also. He kind of just softly want on that. Well, there's lots of jobs in sports that don't involve playing.
For
Um,
sure, for sure.
but not very many people at, 15, 17, 18, hell, 20, whatever, say, I want to work with people struggling with addiction. I think obviously not 100%. And I think it's really cool when somebody just develops a passion for that. But I think it's a field where a lot of people truly have been touched by it and been affected by it and seen it, which obviously, as we know now, it's almost a matter of not if you have somebody in your life or if you know somebody that's affected by substance use disorder. It's more of a question of how many people, in your life or do you know that are
Very
affected
true.
by it. And and so, I think it's all part of the stigma going away and the more we can get passionate, motivated people to work in the field, the better the numbers will continue to be as far as like, overdose deaths decreasing and, cost to society and just people getting better. So,
I'm really glad that you said that about decreasing the stigma because one of the things that is like a mission inside of a mission for me, so to speak, is really trying to decrease the stigma, one employee at a time, one patient at a time, and really providing that education on understanding addiction as a chronic relapsing brain disorder, really understanding it as a medical condition and not just that moral failing, just not that you're a bad person. And in little ways, making sure that our staff uses the right nomenclature or the right words to describe it instead of, drug abuse, substance use disorder, and putting it more into that frame has been like a mission within a mission. And I do think that if one by one we just really work on those things to help to decrease the stigma within ourselves and each other, that starts to kind of permeate that whole, invisible string between people, how you touch one life and they touched, one life and so on and so forth. And it snowballs, so to speak. And that's been, a mission within a mission.
Yeah, no, that's to piggyback off that a little bit. I think that I'm really grateful to the medical community because, I've been in the field for, oh God, I don't know, 30 years almost. Whenever 1998 was, right? 27, almost 28 years ago.
Yeah. Yeah.
And even then, I mean, that's not that long ago as big scheme of things. And even then, it was still pretty much like, considered a disease by people in the 12-step recovery community and a couple of scattered, doctors, psychiatrists, hospitals, throughout the country and things of that nature. And in the past couple of decades, the mainstream medical community has gotten so on board with that, um, with ASAM, and I'm not saying ASAM was created after that. I don't have that time memorized, but it's certainly been more on the stage
Yes.
over the past 20 years. And now it's not even it used to be a pretty passionate, whatever you want to call it, debate or argument with even family members or people in the community who did consider it kind of a moral failing. Sometimes even of their own, if their son or daughter or spouse had an addiction problem, they were so guilt and shame ridden as like, how come I couldn't fix this or how come I couldn't prevent this from happening, that they almost had no choice but to blame it on, well, Billy or Susie is just weak-minded, or I didn't raise them this way, or et cetera, et cetera. And now it's completely flipped in my opinion. Now, if somebody says it's not a disease, it's like, we might as well go say like heart disease is a disease. I mean, it's the medical community says it's a disease. It's no longer a
Yes.
theory. It's no longer a debate. It's, you're on the opposite side of the deal if you're closed-minded to that. So, no, I think
I
that's really
wholeheartedly
important.
agree. It is, it's so important. Again, just to get that word out there to understand because I do think that stigma prevents people from getting the assistance that they need. It prevents people from taking medication assisted treatment. It prevents people from treating it like the disease process that it is. So, it's so important.
No, no doubt. Kind of along those lines, what's something you would say about addiction treatment that the general public often misunderstands, and how can we work to change that narrative?
That is a great question and parlays into that so well. I think one of the significant things that I talk about is really understanding the disease process of addiction. Is something that I wish that the general public knew. I wish that more of my patients knew when they walked in the door, but I definitely make sure they know before they walk out the door. It's just really looking at addiction in that medical mind frame. Again, I explain it this way to patients, and so hopefully you will humor me as I explain addiction to you as if you don't know exactly what
Well,
it
you
is.
can always learn, so, I'll
but
let you.
but humor me for a minute. And so what I told them is, so let's just talk about addiction in the frame. Yes, it starts out as a behavior, right? Someone, drinks or they use a drug or substance or whatever that thing is. And it starts off initially as a choice. They want to try it. Their friends are doing it. Or maybe it is even I hurt my back in a car accident and my doctor prescribed me opioids. So it does, in fact, start off as a behavior. It starts off as a choice that you have. But what happens inside of your body, inside of your brain, is a series of reactions that start to create a tolerance and starts to create more of that drive and that need within you. So at some point, that switch flips from being a choice and a behavior to now your body requires or needs this thing. And if you don't have that, it no longer functions in the normal way. That's most of us can at least accept that portion about addiction. But the aspect that I do want for people to see is that sounds very similar to me to some other medical conditions that I feel like as a whole, we do tend to accept, such as diabetes type 2. Starts off as a behavior. An individual may be eating more high carbohydrate foods or eating more sugary foods or things that aren't necessarily, the best options as far as for glucose control. So it starts off as a choice. It starts off as a behavior. It's something that you continue to do. And at some point, those beta cells within the pancreas, switch flips and it no longer is that choice. Your body cannot produce enough insulin to keep up with your glucose at that time and keep your glycemic index where it is. So most people understand even that process within diabetes, but they don't view getting diabetes as a moral failing. They don't view it as, well, you were a bad person, so that's why you got diabetes, or you made really awful choices, and that's why you got diabetes. But really, that course is the same course. And just like when a person has diabetes, if we do get them on good treatment, if we get them on the right medications, if we do get them, on interventions and therapy, whether that's, a dietitian or a nutritionist, or, maybe for some, they need to have food therapy where they talk about their relationship with food or relearning and recircling some of those things. Then they go through treatment and they get to a point where that diabetes is in remission, where that diabetes is no longer, persistent and active. And that's the same sort of course that we go through in addiction. It is really that sort of remission and relapse, and the potential is there. So I even try to explain to our patients, if you had diabetes and I told you, hey, we need to get you on this pill or we need to start insulin, you may not like that, but you'd be a little bit more understanding to that you need these things. A lot of times in addiction, it's not that way. When I talk to patients and I say, hey, maybe we need to be on naltrexone, to help with your body's, cravings, or with your body's how it processes alcohol or opioids. Maybe you need to be on this oral treatment. Maybe we should try a long-acting injectable to help treat this so that it does go into full remission. But even with our patients or with their families, it somehow doesn't that piece doesn't link together in the same way. They see it also as a failing. Well, if I have to take a pill, or if I have to have an injectable, or if I have to do treatment in some way for longer than, X amount of time, then that's not me really being in a remission. That's not really me being in recovery. And it is, because just like if that diabetic decided after having good glycemic control for 6 months and said, nah, I don't think I need, this insulin anymore. I don't think I need to take this pill anymore. What happens? They relapse. Their glucose is gonna go right back up. They're going to get sick again. They're gonna have to go into the hospital or see a doctor or any of those things. And so we accept that as being kind of a universal understanding and a universal truth, but we don't give addiction that same understanding in that same sort of mechanism. The same is to be said for hypertension. For some, it could be diet or lack of exercise. It could be familial or genetic, which all sound really similar to the pathways that addiction can occur as well. And again, what happens? You might lose weight if you have hypertension, which helps improve it. You might, take your medications. You might change your diet. You might need a pill to help to control your blood pressure. But what happens when you come off that blood pressure medicine? A relapse. You then, blood pressure goes up again. You start having those same headaches and symptoms and need treatment. And I wish that the greater community and the public really accepted addiction in that same understanding and in that same mechanism, that those pathways are incredibly similar. Those pathways are incredibly parallel to each other in the way that you obtain or you get that disease process, so to speak, whether it's genetic or it's behavioral or it's a choice or however you want to look at the introduction of those things. Once that diagnosis occurs, that medical treatment and intervention is necessary, and that may include longevity of those treatments. That may include a lifetime of medical intervention or treatment, whether it's a pill or an injectable or it's seeing your therapist or going to your AA meetings, whatever that thing is. So I really do wish that that was one of the things that people accepted, not just as lay people, but also as those going through addiction themselves. That's usually a hard leap for most people or a river to kind of cross. And I do think it's incredibly important and incredibly useful to really use and frame it in that way. We don't create that same sort of stigma behind diabetics or people with hypertension, but we do with those with addiction when the pathways are just undeniably similar.
Yeah, it's interesting when you were talking about that, I was thinking about how much that carries over into just generally how the public or people, or however you want to say it, view even mental health treatment, diving into that a little bit. Forever, not that everybody's always gone, but forever it has been common practice to, you go to you do a checkup every year or a couple of times a year or, but when it comes to therapy, so if you recommend therapy to somebody, a lot of time, well, I don't know about that. Which really means what will people think and what, for some reason, and I am optimistic that this stigma, I guess that's word of the day, but that this stigma is starting to change. Shout out to all the, public figures in recent history that have talked about their mental health, struggles. Simone Biles is always the one that pops in my head, but people of that nature that have made it more public. Because I do think people are starting to understand a little bit more, or at least I'm optimistic that people are starting to understand a little bit more that like mental health, of which the substance use disorder issue is in that category, is a real category. That's a real concern for all human beings. It's a real area of maintenance for all people.
Yes.
And, and until we as a community or as a people, if you will, are honest about that and are willing to face it and accept the help that is out there. Just like we'll go, if you're sick, you go to the doctor. Nobody thinks you're weak. Nobody thinks anything other than that you're just trying to get better. And I'm hoping the tide's turning in that direction for what we specialize in also.
Yeah, I really hope so too, because it is, it's one of those things. And even, within my friendships, I won't say any particular names or or give examples. Um, but I will say that I know that I have lots of people who call me, for medical advice. And they'll call and say, "Oh, I have this rash. Do you think I should go in and have this looked at?" Or, but if I'm talking to, a friend or family and they're like, "Oh my gosh, I'm like really struggling. I'm crying so much. I can't pull myself out of bed." And I go, "Oh my gosh, you need to go in and you see your doctor. You need to talk about this." "Oh, no, it's not that. I just gotta, I just gotta go through this. I gotta get tougher or I'll figure it out." And it's like, your mental health is so important. It's very difficult for you to get up and take care of your children or go to work or do those things if you're suffering internally. It really is an inside out sort of thing. And I do wish that people start to have more conversations about that it's okay to, need help, whether that's therapy or if that is a medication or if that is, a treatment like TMS or any of the many other things that are in the mental health realm. I really hope that, at some point during my career that people start doing those same sort of annual exams you were talking about, those checkups, that it becomes so commonplace for us to be concerned with our wellness and so real, such a real part of our lives that we have those annual, "Oh, I'm going to see my therapist," and it's treated in the same way as going to see your dentist, because it really is that important.
No, amen for sure. So let me ask you this. Being a nurse practitioner, specifically in the role of medical director, is generally pretty rare in a space that's mostly held by MDs or DOs, different types of doctors. I mean, how do you think being a nurse practitioner has affected, your role as medical director, and how do you envision the future of collaboration in this space?
It is a very different thing being a nurse practitioner and medical director and holding that dual hat. And I think that a lot of times, even, to this day, when I tell people, oh, I'm the medical director. Oh, and they say, oh, are you, a DO or you a medical doctor? I go, oh, I'm a nurse practitioner. And, the look that you kind of get like, well, really? You can do that? You have the capability? So it is kind of a strange, and I think that a lot of it is the role of nurse practitioner is relatively newer. And in newer, I mean more so in the last 50 years or so versus I think, I don't even know the longevity of physicians or that practice, but hundreds of years I'm sure at this point. So it is a newer career path and a little bit different. And the training that nurse practitioners receive is very different because you come in at kind of a ground level at the bedside and you are the one who, is there with the patient for X amount of hours. You're administering those medications, you're bathing them, you really are providing whole person and holistic care. And as I've continued on with my education and even beyond just my traditional schooling and traditional education, research is something that is incredibly important to me. Continuing education is something that is incredibly important to me. Many of the people who know me, and I'm sure who will watch this, have heard me say 1,000 times, I don't like talking unless I know what I'm talking about. So continuing to get that education has been really, really important. And from ground zero, being a nurse to becoming a nurse practitioner to now being a medical director, holistic and all encompassing care has been the central theme. So it's not just about medications. It's not just about specifically the mechanism of action of that medication. It's not just about the pathophysiology of the disorder that a patient has, but it's about how does this affect the whole person? How will this medication not just work in your body, but is it feasible for you to take it based on, your work day? Are you able to take that based on the fact that you're, a mom or a dad in a busy schedule? And is it realistic for you to be able to do this intervention that I'm asking you to do based on your life? I have a lot of particular interest in blending Eastern and Western medicine and creating that holistic view because of that connection that I got as a nurse at the bedside and making sure that, yes, I can prescribe sleep medications for you. But what I also know is equally as important is sleep hygiene, is the environment in which you are trying to get your sleep, and meditation, and making sure that you have a good set sleep routine. And I think that a lot of that comes from my training as a nurse, and the focus of nursing being holistic care. So it has allowed for me to provide an environment being the medical director where our central focus is all of those things, is really looking at the whole person. Not only does this intervention work from a research practice or from a mechanism of action, but does this intervention work for this particular patient and how is it going to affect their life? And that is something that I feel like has been um, a journey that is ever evolving, but definitely has its roots in the holistic care that nurses have. And being a nurse practitioner in this role and being able to advance my career in ways that, you know, I never even dreamed of, and being able to impact an organization in the way that I have been able to does make me want to educate other nurse practitioners that this is a pathway, that you can be a leader in the medical field, that you can be a person who makes decisions and creates protocols and policies and be very encompassing and professional and well versed and an expert in your field, even without being a medical doctor or a doctor of osteopathic medicine, but being an expert in your field of nursing practice and holistic medicine. So it really has been a journey that I will continue to advocate for nurse practitioners. We are still in a state in Missouri where we do have collaborating physicians. And nurse practitioners do not have independent practice in Missouri. And I have been extremely lucky to have physicians who were very comfortable with the care that I provide and felt really good about my expertise and who would back me up and felt like my she knows her stuff and she could absolutely do this job. I've been very lucky to have those, but I hope that the state legislature sees that there are advanced practice nurse practitioners such as myself who really do have not just the education but the experience and skills to pursue, roles in leadership and to potentially pursue, independent practice. So I will continue to advocate for that and hope for those things. And again, working in tandem, working in a capacity with physicians, with psychiatrists, with internal medicine doctors, and being able to have that conversation amongst different types of professionals is really essential. I don't by any means think that nurse practitioners are taking the place of physicians in any capacity. I think that it's an adjunct because we're all here to do the same thing. We want to take good care of people. We want to, advance the purpose of wellness and health, and it's easier to do that working together than it is to divide us. So I will continue to try to advocate for those things.
Yeah, and I've always thought, and I have kind of limited experience in this, obviously, but I've always thought that the relationship that you have with the collaborating physicians that we work with, that they see that as advantageous because they're able to, support you medically and offer their expertise, but then trust you and your personality to work with the patients and to kind of carry that bedside manner along with the research that you do and all of those things. It's really kind of a perfect team, in my opinion.
Yeah. Yeah.
And so it's really cool to hear you kind of talk about that.
Yeah, we've been really lucky to have amazing collaborating physicians.
Yeah, that's certainly for sure.
Yeah.
Let me ask you about this. How do you balance the demands of compliance with the creativity and compassion needed to truly transform patient care in this space?
I think that everything starts with a good idea or filling a void. So, I like to lead with the heart first and then check and make sure that that compliance piece is in. So, for instance, if we're like, oh, it would be great if our patients, had windows in their rooms, or let's just use that example, right? Fresh air, we know the benefits of vitamin D, we know the benefits of the sun and all of those things. So let's do that. But I understand that we can't just operate off the heart. We also have to make sure that those other boxes are checked, that patients are safe, that our regulatory body said that that's okay, or, that we do it in the right way. So just making sure that we always start with the heart. We always start with that bright idea. What's best for patients? What's best for staff? What's going to make MRC really cool? And then I, go back behind and say, "All right, but does Joint Commission say that that's cool, that we can do that? Does the regulatory body say, yeah, that's also cool?" So if we're looking at windows, all right, is there a certain, can they open a certain amount? Can they, and just really checking behind that. So making sure that I cross my T's and dot my I's, so to speak, so when we come up with those great ideas to really provide excellent patient care based on sometimes patient feedback, based on staff feedback, based on, us sitting in a room as leaders and deciding what we think sounds cool, just making sure that all those ideas have their checks and balances and that it really is not just going off the cusp, but making sure that we do that good idea in the proper ways, and I think that it's always just balance, making sure that we get best of both worlds.
Yeah, no, I totally agree. I know it's something that we've talked about and the team has talked about a lot here that sometimes, and I'm not thinking of any place in particular, so anything like that, but I do know historically there have been places that sometimes overemphasize the extracurricular parts of it and the different stuff, and then lose or don't pay as much attention to the quality of care, and which is really what we're all about. You know what I mean? Obviously, you got to have some of both. And, if your treatment center or any medical facility or any facility that offers anything really is a dark hallway with like one swinging light bulb and no running water, I don't care how good your care is, you're not going to have any cushions, and you probably shouldn't. Um,
Yeah.
on the flip side, if everything is amenities and, we're going golfing every weekend for therapy, I don't think any place does that, but, so sorry, big golf fans. But sometimes what can get lost in that is, well, how good is the therapy? How good is the medical care? What are we really learning here? Right? That is going to stay with us as we move forward for the rest of our lives. Cause that's what it's about, right? It's about learning the coping skills to transform your life and be there for your family and your job and yourself and your friends and all of that. Not necessarily, how many spa days can you get in while you're in a treatment facility. Again, having both is the goal, and we all strive for that, and all that stuff. But at the end of the day, it's a quality of care that really matters. Um, and I know
That's what
you believe that.
trumps it all.
Yeah.
No, for sure. That is the bar. And, I've always been a popular nerd. So whereas that background stuff like quality of care, the book smart stuff, the making sure that you have like that base has always been really, really important to me. And the popular aspect, yeah, I wanna have fun. Yeah, I was cheerleading captain and I did some of those other things that were really fun, but making sure that you have that good basis and making sure you have the good ground level, which is, are we providing evidence-based, great exemplary care, and all the other stuff that we get to add is fun. It's just, like icing on the cake.
I'm glad you called yourself a popular nerd because earlier when you were talking, I was like, God, Shay really is the coolest nerd that I know. But I didn't want to say that out loud. But then you said it. So
It's
that's
very
yeah,
it's so accurate.
right.
It's so accurate.
Yeah. Oh, I know, and I've called you that privately, but I
Oh,
did on
yeah.
public forum. I didn't know. So I'm glad you went there. All right. So let me ask you about this. What do you is kind of a deep one here? What do you hope your patients, your staff, and even your family remember most about your work and your legacy?
What I hope that my colleagues, my patients, my kids, my legacy is being authentically me. I hope that people understand that I really truly do pour my heart into everything that I do. If it doesn't deserve my heart, then it doesn't deserve my time. And I hope that people see that true, authentic Shayisms in a little bit of everything that I do. The fact that, I may interact with the patients in a way that some may think is a little strange because, I'll joke around with them or, I'll, you know, be just a little bit more informal and some of my roots come out and they see those things, but that's authentically me, and I can be both a scholar and an achiever and an intellect and a nerd, but I can also be me, which is just a girl who saw The Cosby Show when she was 5 years old and said, "Ah, that was cool. I wanna do that. I wanna take care of people." And here I am still to this day in 2025, still that girl on the inside that just really wants to take care of people and make a mark. And get to be myself while doing it. I still wanna have this curly, cutesy office. I still wanna wear heels while I click through the halls and see patients. I still wanna, you know, ask my patients, "Did you hear about Taylor Swift and Travis Kelce getting engaged?" But I also can do that and be authentically myself and integrate my heart into the work that I do and still have that scholarly expertise and professionalism, and I really want for just my legacy to be very authentically real and true, and that it wasn't candy coated or false or, even molded into some person that the society or the world or whoever thinks I should be, but being able to just provide a unique perspective that is me.
Oh, that's awesome.
So
And by the way, I'm gonna take credit for officially breaking the news to you about the Kelsey Swift engagement. I know you're on the phone with Kristen
it
Cecil.
was Kristen Cecil. You do not get
Oh,
credit for
she
that.
was a
I had
kind
no idea.
leave her. I confirmed it.
Nope.
So
Nope. You don't get it.
we're
You
there.
even made me not know that they got engaged for way too many hours.
Yeah, right, right. Well, there's a Kristen Cecil shout out on the podcast.
It
So
was on the podcast. I hope she watches.
me too. All right, let's do a couple little fun ones here. What would be one word you would use to describe Midwest recovery centers?
Innovative.
Oh, I like that. I like
Mm.
that. All right, give me a book or a quote that's guided your leadership.
I know what you think it is. Because I say it every day. Not my
Yeah,
circus,
right.
not my monkeys. That
Yeah,
is
right.
not the one though. That is not it, even though that is probably I use that 27 times a day. And this too shall pass. And that's not just my leadership. I think that that is my life quote is, and this too shall pass. Things get rough, things get hard, but like all things, and this too shall pass.
Good one. All right, super bonus here. I'm going to tell you my favorite quote. I don't think I've ever told you this. It's by Muhammad Ali. And it's not the everybody thinks of the float like a butterfly, sting like a bee, which is great. But he has this great quote, and it's basically says, "Inside of the ring or out, there's nothing wrong with going down. It's staying down that's wrong." And I
Ooh,
love that. Isn't that a cool quote?
that's
It's
really
because
good.
everybody's gonna get knocked down a couple of times in life, or maybe
Oh,
more,
yeah.
like a couple of times a year for something.
Yeah.
And it's all about resiliency, and that's a big thing with
I love
addiction recovery. And yeah, isn't that great?
Yeah, that's a really good one.
Yeah.
Huh.
All right. And last but certainly not least, what would you be doing if you weren't in medicine?
Nothing. There I mean, there is I truly it's so funny. I get asked this question a lot by people. I really do. Like, "What's your dream job?" And I know it sounds terribly cliche. I truly there is nothing else in this universe that I would be doing that I want to do besides medicine. This is my dream job.
Right.
I've, switched, the type of medicine I practice many times over. I've done everything from geriatrics, hospital medicine, emergency medicine, so on and so forth, and now in this. But I honestly am one of those rare people who I feel like I found my purpose very, very early in life. And I truly do feel like I was put on this planet to practice medicine. I truly feel like this is my calling. This is my niche. This is what I'm supposed to be doing. It is me and I am it. I don't think that there is anything else that I would be doing if I was not practicing medicine. That I would be that I want to do. But I can add a caveat in there. Fun fact, what I would be doing when I retire from medicine, which will be when I am 99 years old and not
I
gay, I
That's
will
good
be
to know.
working at Cracker Barrel as a
That
hostess. That is my dream retirement after medicine. So I didn't that's not like in lieu of, but after medicine is definitely gonna be Cracker Barrel because I love it so much. And that is my end game.
that is awesome. Now, are you excited to hear that they just came out today and said they've decided to keep the old sign?
Oh, they
Logo.
are?
Well, thought that was kind of cool. I guess so many people were like, keep it, keep it, keep it. They decided to keep it. So,
Oh, that makes me happy
um,
because I am very old school Cracker Barrel, so
yeah,
I'm really happy. That's my
yeah,
retirement plan.
that is awesome.
People are gonna be
Well,
like, "Cracker Barrel? What's wrong with this lady? We
yeah,
were in."
hey, you know what? Mine is I'm going to be an usher at Royals games. So I don't think that's any
Oh,
more
how
as in the
cool.
Diamond Club section. I'm not walking around in the heat of summer outside.
Oh, you're not gonna, like, throw hot do they throw hot dogs? I think I just made that up, but
No,
when
that's not. I don't think they do that anymore anyway. I think somebody. You know what?
oh,
And we're totally going off the rails here, which is not
that's
that weird
okay,
from
that's
us.
okay.
I think it was actually the Royals that they used to have that hot dog gun, like, that was a big
Yeah.
thing, and somebody got hit in the eye with one and then sued the Royals. This was 10 or 20 years ago, and so I don't think they do hot dog guns anywhere anymore.
Oh, wow, okay, so you will not be the hot dog gun guy. You will be
No.
nicely handing it to people
Yes,
with
and
your hot
not to be, make it about semantics, but that's a vendor, not an usher.
Oh.
Anyway, I would just show people where to sit and then gossip with them the whole game because that's what the vendors in
Oh,
our
okay,
city
that's
told
better.
us. Yeah,
That's better.
and they're awesome. So, well, it's been great talking with you and, very educational and informative and fun as it always is. So I really appreciate the time.
Thank you so much. It really has been a pleasure, and I could talk all day about MRC and my love for what we do and all the many, many things, because, MRC is one of my babies too. It's
Yeah.
just like all those other thousands of kids I have. It's only 6, but it feels like 7,000. The number
Yeah,
changes.
it's thousands to me because I got 2, and that's crazy enough. So, yeah, trickle that
It's a
amount.
lot,
Things are really big,
but
but,
MRC is just
but
so special, so I'm always happy to talk about it, and I hope I'll be invited back to the podcast to talk more.
hey, me too. So,
Yeah, seriously, right?
yeah, awesome.
Oh,
Well, have a great day.
thank you. You too.
Take care.
Bye.
All right. Well, first off, big thank you to Shay McNeal, the medical director here at Midwest Recovery Centers, for joining us. Excellent conversation on how the medical component of treatment works and really highlighting some of the stigma around addiction that she and the rest of us here are working to defeat, if you will. So, thanks again, Shay. That was awesome. Brief reminder before we sign off here for the day. If you or anyone you know is struggling with addiction, mental health, questions, any of that about those topics, please give us a call. Thanks for joining us today. Have a wonderful day.